Okay, so on to the concept of inflammation. We are on page 669 in your book. This goes along nicely with just finishing up the concept of infection, because we've talked a lot in the classroom about the inflammatory process. You guys understand that the body sees an event as a harmful event. It reacts to it. It's a protective process that your body has. We understand that it usually resolves, that the body will take care of the actual harmful event, but we also understand that sometimes this is not the case, and that individuals do develop what we call an autoimmune disorder. Some examples of autoimmune disorders would be a couple of our exemplars: the inflammatory bowel disease. Also, later on, we do rheumatoid arthritis. We talk about peptic ulcer disease. So these are great examples of the concept of inflammation. These are the learning objectives for the concept of inflammation. Be sure that you read through these prior to studying, and then make sure that you review them prior to the next exam. Make sure that you review the anatomy and physiology. That would be on page 669 to 772. We have talked in class before about how you want to make sure that you assess for pain, swelling, redness, heat, a potential impaired function of the body part that's injured. You guys, we've talked about the itis actually means inflammation, so you guys understand that. You know that the inflammation can be the result of exposure to a physical or chemical agent or microorganisms. As usual, lots of new terms for the concept of inflammation. You want to make sure that you review these. There is an excellent picture that kind of outlines the process or what's going on when someone has the inflammatory process going on. That's on page 671. It's on the bottom, figure 10-1, so make sure you take a look at it also. Okay, make sure you pay attention to box 10-1 on the top of page 672. It talks about anaphylaxis. You guys have heard about anaphylactic shock before. You know it's life-threatening. As someone is exposed to something they're allergic to, they may or may not know this. The actual signs and symptoms occur within seconds to minutes, and it includes swelling of the throat. It could be to the point where the individual cannot breathe and requires a trach. They'll develop hives, wheezing, hypotension, become weak, lightheaded, develop nausea, vomiting, and diarrhea. So if you're out of the hospital, let's say you're at the ball field, for instance, then you want to make sure that you activate EMS. Always ask if possibly they're carrying an auto-injector of epinephrine. The preferred route for epinephrine is IM. If we don't have epinephrine available in an IM strength, then we can go ahead, we can give it IV. If someone actually has no IV access, for some reason we can't get our hands on an IM dose of epinephrine, you can put it down the endotracheal tube if they're intubated. So our first priority would be to make sure that we have epinephrine, give it IM, and then we would want to make sure that the airways protected and place them on oxygen. We might give additional medications. For instance, we talked a lot about albuterol when we talked about COPD. We might give that for the wheezing. We might give antihistamines to help with the histamine response, such as Benadryl, and we also might give IV steroids. Looking at page 673, it talks about the different issues that we have with the process of inflammation. It talks about pain. You guys understand how to assess for pain and how to treat pain. Analgesics, which we actually talk about at the end of this chapter. Treat the underlying cause, and if relevant or appropriate, do heat and ice or ice therapy. The edema, we want to make sure that we assess the swelling. We understand why the patient has swelling as part of the inflammatory process. We can, if necessary, treat with diuretics, tell them to decrease their salt intake, identify ID and treat the underlying cause, elevate, compress if appropriate. Heat, we understand why they have heat. We want to assess for heat at the site. If it's a localized response, if it's a widespread response, we want to make sure that we assess body temperature. We can give antipyretics and possibly apply ice. Impaired function of the injured tissue, then we just again want to assess and treat. We want to possibly give analgesics if it's painful, and give analgesics if painful, and encourage adequate rest and sleep and possible physical therapy. If there is an alteration in oxygenation, then we again would want to assess for this. We'd want to look for the labored breathing, the dyspnea, the changes in the O2 sats, lung sounds, chest tightness, sputum production, identify and treat the underlying cause, give some oxygen, maybe some bronchial dilators, encourage the use of an expectorant, adequate sleep and rest, and monitor your ABGs and O2 sats. And if there's an infection, we want to again identify that there's an infection, that it has changed from an actual inflammatory process to an infection, identify and treat the underlying cause. This could be antibiotics, antivirals, maybe give antipyretics and analgesics, adequate fluids and rest, and make sure that we follow up as far as effectiveness of treatment. It is easy to tie in many related concepts to the concept of inflammation. We know, for instance, that we have many blood cells and components of the inflammatory response which are mediated by the immune response. We have examples of immune or autoimmune diseases such as rheumatoid arthritis, which is an actual inflammatory response. We understand that when we have a microorganism that enters the body, it causes or triggers an inflammatory response. We want to make sure that we assess if we have a local inflammatory response or a widespread inflammatory response when it comes to dealing with infections. For instance, with mood and affect, we often give steroids, and we talk about this at the end of the chapter, for treatment of the inflammatory response, and we know that they affect mood and affect. Anybody who has been on steroids or has taken care of someone who has steroids, you understand the mood changes that occur. Oxygenation, there are certain infections that trigger an inflammatory process that will also challenge the respiratory system and possibly result in alterations in oxygenation. We have talked about a couple of these. For instance, one of them is pneumonia. We have also talked about COPD. You have talked about asthma in pediatrics. There are safety issues related to the inflammatory process. For instance, if you have anaphylaxis, the safety concerns are airway obstruction. The safety concern is a lack of education related to not carrying your epinephrine. Certainly there's a safety concern if we would abruptly stop steroids and possibly patient goes into adrenal insufficiency. And not a concept, but we need to talk about health promotion. When we talk about health promotion, this talks about many patients who have inflammatory responses understand or they have identified their triggers. And so we just need to make sure that they avoid these triggers. We also want to make sure, of course, that we have good hand hygiene to avoid infection, which avoids the inflammatory response. We, for instance, can also help them with avoidance as far as when we talk about irritable bowel disease. These individuals need to keep a food diary so they understand what foods that they need to actually avoid. And then treatment. They need to understand their treatment. Many of the treatments are very specific, such as when you're diagnosed with anaphylaxis related to bee stings. Then you understand that you need to carry your auto-injector of epinephrine. There has been a lot of news regarding particular foods that help with decrease in inflammation. And so if they're not contraindicated, these are listed on page 675 in your text. It talks about things that we should encourage are the omega-3 fats, slow digested carbs, antioxidant-rich foods, and probiotic foods. Also encourage nuts, soy, dark, green leafy vegetables, tomatoes, garlics, onions, turmeric, and healthy fats, beets, olive oil, and whole grains. Starting the nursing assessment, we start with observation. The patient walks into your clinic, the emergency room, physician's office. What does the patient look like? Look at their skin. Is the skin moist? Is it dry? Are they diaphoretic? Look at their eyes. Do their eyes look swollen? Do they look red? Is there any type of discharge? Do they look glazed? What is their respiratory effort? Do they appear dyspneic? Do they have a cough? Does the cough sound moist? During the observation, you're trying to identify why they're coming in for a possible inflammatory process. We move on to the patient interview. What does the patient report regarding signs and symptoms of inflammation? For instance, they're coming in, they're complaining of, let's say, right lower side abdominal pain. They've had nausea, possible vomiting related to the pain. They have a fever, then we're concerned that they have appendicitis. And so then during our patient interview, we would ask them specific questions about appendicitis, and during our physical exam, we would make sure that we would want to focus on the right lower abdomen. We want to make sure that they don't have any chronic conditions that are related to an inflammatory process. We've kind of touched on these, the different autoimmune disorders that could lead to a chronic inflammation. We want to know certainly what kind of medications that they're taking, any medications the patient might take for chronic inflammatory processes or autoimmune disorders. When we move on to the physical exam, guys, you want to make sure that, are we dealing with something that's localized? For instance, is it a wound? When we look at the wound, where's the wound located? We would want to know the size of the wound. Is there pain? Is there tenderness? Is there edema? Is there a discharge or drainage? And what does that drainage look like? If it's widespread, then you guys know that we need to assess for signs and symptoms of a widespread inflammatory process, such as fever. They're tachycardic, they're tachypnic, they might have general malaise and body aches. Looking at the diagnostics, the good news is many of these we've already touched on in class. And so we've talked about the ESR, it's the erythrocyte sedimentation rate. We've talked about the CRP, the C-reactive protein. Both of these are elevated in inflammatory processes. FYI, you do not need to know the values listed in the book for these. It is important to understand that often these two particular lab tests are just naturally elevated in the elderly adult, and that the C-reactive protein cannot be accurate if someone has liver disease. We have talked about the white blood cell count before. We know that an elevated white blood cell count is called leukocytosis. If you guys look in your book on page 677, then you'll see we are actually breaking down the white blood cell count. We've talked about in class, you have an elevated white blood cell count. You understand that a lot of times they'll do a differential. Why is the white blood cell count elevated? What are the particular types of white cells that are showing up? In the inflammatory process, this is important. We have talked about, for instance, the neutrophils. We know that the neutrophils show up in acute infection or a stress response. So often we see elevated neutrophils. We have not talked about eosinophils, but it is important because they are elevated in an allergic reaction, such as anaphylaxis, and an autoimmune disorder, such as rheumatoid arthritis. The basophils, again, can show up in an allergic reaction or a hypersensitivity response, and so we would see these, for instance, if someone had a blood transfusion reaction. The monocytes show up as a chronic inflammatory disorder, and the lymphocytes can show up, again, in infections and viral infections. All right, so talking about collaborative therapy, let's talk about health approaches. We've mentioned diets. You guys will understand when we go through, for instance, IBD and peptic ulcer disease, that there's particular diets individuals need to follow. And you'll also understand that, as I've said before, there are some supplements that we believe can reduce inflammation. Some of these are the omega-3 fish oils, the flax seeds, some of the vitamins. When we look at pharmacological therapy, you guys need to go ahead, grab a marker or a highlighter, and turn to page 679. Many of these medicines you're going to be happy because we've already covered. NSAIDs, the nonsteroidals, the examples would be aspirin and ibuprofen and noxaparin. These guys can act as analgesics or antipyretics and anti-inflammatories, and so that's why we're giving them for the concept of inflammation. We know for one thing that you need to understand is that they stop the conversion of COX-1 to COX-2, and this stops the inflammatory process. But while we stop the process of COX-1 and COX-2 and we decrease prostaglandins, you also have to understand that we're decreasing the protective nature of prostaglandin in the stomach lining, and this is why these are irritating to the stomach. We need to make sure then we need to administer with food or milk. We need to make sure that they are not given when someone has PUD, that we shouldn't give them when someone is on an anticoagulant, that they can interfere with certain types of diuretics, that we need to be concerned about the kidney function. Next, we've talked a lot about the corticosteroids. Gives you some examples on page 679, and these guys are potent anti-inflammatories, and therefore they help in the process of inflammation. You guys understand the majority of these. You know that they they can lead to a systemic infection, that we need to make sure that we obtain baseline vitals and weights. They can cause people to take on weight or in the form of edema. We want to make sure that we administer and taper as ordered, that we want to monitor the blood glucose levels. It could increase the blood glucose levels. We understand that they could cause Cushing-like syndrome, and that if we withdraw the patient too quickly, they could develop adrenal insufficiency. Next, it talks about the opioid analgesics, such as hydromorphone, fentanyl, morphine, oxycodone. These guys are potent analgesics. They alter the patient's perception of pain. We know that we should take these with food because they do cause GI upset. We know that they slow everything down, right? And so that we need to assess for urinary retention and constipation. We want to be cautious when someone has renal impairment. When we said that they slow everything down, that means that they too could slow down the respiratory rate, and we would want to assess for a change in the level of consciousness. And we've already mentioned the natural therapies such as fish oil and omega-3s. We move on to surgery, and surgical intervention for the concept of inflammation could be so many different things. And so I just put a few things down here. If someone, for instance, has a wound, the wound certainly has an inflammatory reaction. We've talked about this. It's possible that the wound could become infected, and the patient would require what we call an IND, and that just means incision and debridement. It's possible that we could have someone who has appendicitis or cholelithiasis or cholecystitis, and that they would need to have their appendix or their gallbladder removed, and that's what organ removal is. It could mean that someone, for instance, with an autoimmune disorder that has that chronic inflammatory process going on could require a joint replacement. And these are just a few of the many types of surgeries a patient might have to have related to the concept of inflammation. When we look at lifespan considerations, you guys need to just go ahead and review in your text on page 680. It goes through different challenges when we deal with children and adolescents. We've talked about children from the standpoint of having smaller airways and a larger tongue, and so for instance that's important because if we would have a child that would enter into anaphylaxis. We've also talked about how a child would actually suffer potential inadequate oxygenation quicker and could get into trouble sooner, and that children have a higher metabolic rate and that they have a less developed or an immature immune system. When we look at older adults, the main thing that I mentioned was earlier we had talked about the fact that the C-reactive protein or the CRP could actually be elevated just related to the fact that we have an elderly patient. All right, guys, week 10, stay strong, stay positive. And you know where to reach me at pstfodder@hccfl.edu.